So we are into fourth lesson. We are into fourth lesson of the reproductive health, right? So in the third lesson, what we have seen is we have seen the sorry, in the third lesson, what we have seen is we have seen the population issues in India. Right? We have given some metrics of the population. We have tried to define the population very briefly, and then we have understood some population metrics in India, and why do we have this population explosion in India, and then we have seen the importance of desired family sizes, and then we have seen some birth control methods, particularly the natural methods, three natural methods that we have seen in the natural methods of contraception, and have tried to understand what is contraception is, and what's a contraceptive at all, what is the function of a contraceptive, and what are some characteristics the a contraceptive should contain. And after that we have understood the natural methods, and the next of the contraceptive methods that we have is the barrier methods. Yes, the next contraceptive method that we have is the barrier methods. Yes, but natural methods, if you see the natural methods, we have seen three kinds of natural methods, right? So that is periodic abstinence. Periodic abstinence is one of them, and then we have seen withdrawal and coitus interruptus, and then we have seen the lactational amenorrhea and the significance and how these will work will also we have seen. And when you see the barrier methods simply are barriers, right? What are the barriers for? What are the barriers for is they are barriers for the gametes, male and female gametes. What do they do? They physically, right? They physically physically prevent the male and female gametes from meeting with one another. Yes, that's what we are seeing. The ovum and the sperms are physically prevented with the help of these barriers. So that is why, so these methods are simply referred as the barrier methods. So what are some of these barrier methods that we have is, one of these is the condoms. Yes, one of these is the condoms. The condoms are there for the males and the females as well, right? The condoms are there for the males, and the female condoms are also there. So what's a condom is, obviously, so it is a thin rubber or the latex sheath, so that is used to cover the penis in the case of the males, and the vagina in the case of the females, and as well as cervix. So these two are covered with the help of a female condom, and penis in the case of the males just before the coitus, so that when the male ejaculates, so he'll be ejaculating into this latex sheath instead of into the genital tract of the females. So with that we are preventing the physical meeting of the sperm with the ovum, so that the conception, that means getting pregnant, is being avoided with the help of these condoms. And Nirod is one popular brand of condom in India. In India, Nirod is the brand of condom which is popularly sold in India as a male condom, and in the female condoms normally is called as the femidoms. Condoms that generally is referred as the femidoms. So it is a name. Please do remember this name as well. Sometimes it is being asked. And the next one that we have, important question for the NEET exam is, so which of the following methods, contraceptive methods, will have the additional benefit is the question, right? They'll give you various options. So the additional benefit by using the contraceptives called as barriers is protecting the user from containing the sexually transmitted infections, and as well the AIDS, right? So the person can prevent himself or the herself That prevent themselves from getting contracted with STIs and as well as AIDS, because you are physically stopping almost everything, right? As you are stopping the gametes, you are also stopping the contaminating agents, right? In the case of AIDS, right, you are stopping the HIV virus, human immunovirus, from into the body getting into the body. So we have various sexually transmitted disease in the form of gonorrhea, syphilis. All of this we will be studying about these in our next segment. So this is the additional benefit, and the statement is very important for the NEET exam. Please do uh, make a note of this statement. And one more important, these lines are important, so not to be avoided. And one more important point with the barriers is here both male and female condoms are disposable, right? So they're for one time use only. That's why they're disposable. They cannot be reused. They cannot be reused. So why are you saying this? This is in contrast. This is in contrast with our next item. Our next item for the discussion is the diaphragms. The diaphragm, cervical caps, and as well as walls. So these are also barriers, but these are the cups. These are the cups, as a matter of fact, and they can be reusable. They can be reusable, but the condoms are disposable. They cannot be reused. Yes, and this can be self-inserted, thereby giving privacy to the user. And when a question might be asked here for the NEET exam, contrasting these two. Sometimes the statement can be made that, you know, the condoms can be reused as they are being reused for the diaphragms, which is a wrong statement. Right? Diaphragms can be reused, but not the condoms. Okay, so that is about the barriers methods in the form of condoms. And the next one that we have is diaphragm, cervical caps, and walls. Right? These are also barriers. They are also made of rubber, just like the condoms, right? So they're made of rubber and latex sheath here, but these are made of rubber. The form of cups will be there, and these are inserted into female genital tract, particularly to cover the cervix. What we are doing here, so we are covering the cervix. They are inserted into the female genital tract, and what are they doing is they are covering the cervix during the coitus. When the cervix is covered, so what's a cervix? Cervix is the entry to the uterus. From the uterus, so this sperm can go to the fallopian tubes where the fertilization will happen. So by covering this cervix, you are not allowing the sperms into the uterus, so obviously the pregnancy will be avoided, right? So pregnancy is prevented with the help of these caps. Yes, so here they prevent the conception by blocking the entry of sperms through the cervix, which is an opening to the uterus. Yeah, that is the function of the diaphragm, cervical caps, and as well as walls, and these are reusable. So it's a very important statement. So that is I made a separate point for that. So they are reusable, right? So we have seen three important points here in the form of nirod, and additional benefit that we have for the sexually transmitted infections, and how these diaphragms are reusable, how this question can be contrasted with the condoms, and as well for the diaphragms. Okay, and these are some diagrams that we have. Simply, it's a female condom, then we have a male condom, and this is a diagram of uh, an IUD, right? It's an IUD. So I haven't written anything here. So it's an IUD. Yes, and in the barrier methods, we also have one more method that we have. So these are the chemical methods. Chemical methods. What are these chemicals? These chemicals are simply uh, are applied over the reproductive organs during the sexual intercourse, and um, so that the pregnancy can be avoided by killing the spermatozoa, right? So here what we are doing is, so here chemical are used as a spermicidal agents. That means they kill off the spermatozoa, are surface active agents, right, which attach to the spermatozoa to inhibit O2 uptake and kill the sperms. So in a both the ways, they are either inactivating the spermatozoa or killing the spermatozoa, right? Inactivating and killing the spermatozoa in the chemical methods, right? So some example that we have, there is this foam called as Today vaginal foam. So the brand of this foam that we have is Today is the brand. You can Google that if you still wishes to. So that is Today is the foam that we have for the vaginal foam, and cream and jellies. So these are some brand names that we have. Deepas, Defense Institute of Pure Applied Sciences manufacture it. So that is what it's a Deepas. It's a brand name. It's a brand name that is there. And some medicines, are composed of this ZNSO4. So all these chemicals that we have here, KMNO4, boric acid, lactic acid, citric acid. So all of these are the chemicals. And obviously what you can understand by this chemical methods is they are primarily are the spermatocytes. They either inactivate the spermatozoa, or they're simply a kill off the spermatozoa. So that is with the chemical methods that are available. So these names are not given in NCERT, but anyway, you can remember them, which can be useful for you in objective questions. Yes. So these are the chemical methods. And the important of all of the contraceptive methods is IUDs, intrauterine devices. IUDs, you call them intrauterine devices. Why they are called so is they are placed in the uterus, right? They are inserted by expert nurses and expert doctors into uterus. That's why they're called as intrauterine devices. It's a very popular method. So especially they are used by the females. So obviously they are inserting into the females. So males do not have any use for them because they are inserted into the uterus. It's a contraception that is available for the females, and it is not self inserted. It is inserted by doctors and the expert nurses through into vagina into through vagina sorry into uterus, in the uterus through vagina. And we have three important categories of these IUDs. One of these is the non-medicated one, so that is lipase loop. So this non-medicated lipase loop make the uterine environment sterile. That means it does not allow the implantation to take place, and as well as sometimes the phagocytosis will happen because of this non-medicated IUDs. And these names are very important. So this is the one of the most frequent go-to area for the examiner, for the question to be asked So that is we have to be extra cautious, right? We have to be remembering all these names of these IUDs. Now, non-medicated IUDs example that we have is, we have a loop, that is lipase loop is an example for non-medicated IUDs. And there are this copper releasing IUDs. This releases the copper ions, and we're gonna see what these copper ions do, and what are three different kinds of copper releasing IUDs that we have is CUT, CU7, and multi-load 375. So these are three kinds of copper releasing IUDs are available for people who are going for the contraception. And then we have hormone releasing IUDs. So we have two of them, that is progesterone set and LNG 20, right? So LNG 20 is one thing that we have as a contraception. And now, what is the function of the IUDs? IUDs in general increase the phagocytosis of the sperms, including the non-medicated one, right? Increase the phagocytosis of the sperm within the uterus. And when you take the copper releasing IUDs particularly, what are they doing here is, so here the copper ions released suppress sperm motility, right? They are suppressing the sperm motility, so they will be immobile, right? So that means the mobility will be inhibited, and fertilizing capacity of the spermatozoa is also affected, right? They will not be able to fertilize the ovum, that is also being affected. And then we have this hormone releasing IUDs. Hormone releasing IUDs. What do they do here is, so they make the uterus unsuitable for implantation. Unsuitable for implantation. What does that mean here is, so the mucus lining is affected, right? The mucus lining is affected. So when the mucus lining is affected, the implantation will not happen, right? So this blastocyst has to go and implant itself onto the uterine wall, and when you need to have sufficient mucus secretion along with all these blood vessels. So when you do not have sufficient preparation for this implantation, so the implantation will not happen. So that is what the making unsuitable for implantation means here. And the cervix hostile to the sperms, right? Means the sperms will not be able to cross the cervix, right? Cervix, which is an opening to the uterus. So that is the function of this hormone releasing IUDs. And so this is the important line. Okay, IUDs are ideal contraceptives for the females who want to delay the pregnancy and the space the child, and it is one of the most widely accepted methods of contraceptives in India. So the question will be framed here. So following is the most widely accepted methods of contraception in India. They'll ask, obviously you can write that. So the IUDs are the most widely used contraceptives instead of, say, condoms, or the chemicals, all of these IUDs. Because when you place an IUD, so it can be as effective as 3 to 5 years sometimes as well. Yes, so that is why these IUDs are used, preferred by females to use them. And those are the different kinds of IUDs. So the names are important, please make a note of these names. And the pills, the next contraceptive methods that we have is the pills. So these are the oral pills. So what are oral pills, and what is the composition of these oral pills? What do they contain is, they contain the progestogens, and that means progesterone or estrogen, right? Or simply they will have the progesterone or the combination of estrogen and progesterone as well, right? So this is the pills that we have. And these pills come in the form of tablets. So that is why you're obviously calling them as the pills. And how will they be taken? How will they be taken is, so they will be taken for 21 days of the menstrual cycle, right? So please remember these 2 points, very important for you to be understanding here. So we have 28 days of menstrual cycle, right? So we have 28 days of menstrual cycle. It's 28 days. 28 days of cycle that we have. 28 days of menstrual cycle. Then, so how many days that you are taking in this menstrual cycle is, you are taking the pills for 21 days. 21 days. And which days that you are taking uh, the pills, in which days daily you need to take them. Daily you need to take them for 21 days. And what is the beginning date? What is the beginning date is, so here you are starting the pill preferably within the first 5 days of the menstrual cycle. What does that mean? So either you can take on day 2, day 3, day 4, or day 5. So imagine that. So a lady is starting the pill at the day 3 of her menstrual cycle, right? So day 3 of the menstrual cycle, a lady is starting the pills on the day 3 of the menstrual cycle. So she'll be taking the pills continuously for 21 days. For 21 days, right? So that means she'll be taking the pills from day 3 to day 24. Yes, she'll be taking to the day 24, and she'll be leaving a gap of 7 days. Gap of 7 days. Yes, she'll be leaving a gap of 7 days. What is happening in these 7 days? So obviously when you leave a gap of 7 days here, 24, and within the 7 days you will be reaching the 28 here. You'll be reaching the 28 here. So in this time, what is happening? So in this gap of 7 days, the menstruation is occurring. The menstruation is occurring, and you'd be giving the gap of 7 days. And again on the day 3, what you are doing? So again in the next cycle, you are starting the next course of the pills, right? Next course of 21-day pills will be taken. So hopefully we are clear. I'll explain this one more time. So how many days that we are taking the pills here is, you are taking the pills for 21 days in the 28-day cycle of the menstrual cycle. The 28-day cycle of the menstrual cycle, you are taking 21 days. And which days? You all know the menstruation happens from the day 1 to day 5. So preferably within days, within these days. So you can take any day. So I have taken this day 3 here. So this lady has taken the pill on the day 3, and continuously she will take for day 24, right? She will be taking the pills for day 24, and she leaves a gap of 7 days. She leaves a gap of 7 days here, and in the 7 days, the menstruation will happen. So obviously 25, 26, 27, and 28 will come. 28 will come, and the the menstrual cycle begin, I mean the endometrial lining breaks down, and there will be menstruation again. There will be menstruation again, and 5 days there will be menstruation, and she will not be taking pills for these 7 days. 7 days in this menstrual cycle, in the next cycle again. Again on the day 3, again on the day 3, she'll be taking the next course of pills for 21 days. And how long she will have to take these pills? And as long as she wishes to avoid the pregnancy, she wishes to prevent the pregnancy, she'll be taking these pills. As long as, every month, each month, you need to avoiding, you need to taking these pills. You need to taking these pills. You need to be taking these pills to avoid the pregnancy. To avoid the pregnancy. And what happens when you take these pills? So how do they work? How do they work here is, so you can see that here. So these work by inhibiting the ovulation and implantation, as well as alter the quality of cervical mucus to prevent and retard the entry of the sperms. It is inhibiting the ovulation. So this is very clear, right? So how it is very clear? Because the ovulation is happening on the day 14, day 14, and we have started the pill at the day 3 itself, day 3 itself, and it is happening in the day 14, and this 10 days, in these 10 days, so it is not allowing the ovulation to occur, and as well as implantation will not be there. Even if there is ovulation and implantation is not happening, why is that? Because the mucus lining is affected. The mucus lining is affected. So as a result of that, the implantation does not happen. If there is, even if there is ovulation, if there is fertilization, and implantation is not happening. So obviously with the with these two reasons, for these two reasons, the pregnancy will not come. The pregnancy can be avoided. So that is how the pills will work. What do the pill contains is, the pills contains the you know the estrogen and progesterone combinations, and just the progesterone itself. And these are the some names for the pills that we have, that is mala D and mala N. So these are just the brand names that are commonly sold is the combination of contraceptive pills, and we are very effective with lesser side effects, and as well as accepted by the females. And if you recall, we have discussed this Saheli, which is developed by the Central Drug Research Institution. No? This is also a oral pill, and this one is non-steroidal preparation. What does that mean? What does that mean here is, if you take these pills, they are steroidal. The progesterone and estrogen are the steroidal hormones which are derived from the cholesterol, and this one is not a steroidal preparation. Instead of 21 days like the pills, that the steroidal pills, it is not taken for 21 days. It's a once a week pill, once a week pill with high contraceptive value. High contraceptive value is there, and the key point for you to be remembering here is, so this one is a non-steroidal. This one is a non-steroidal oral contraceptive, and it is once a week pill, right? So instead of 21 days, so it's a once a week pill, prepared by Central Drug Research Institute, CDRI. So those are the two kinds of pills that we have seen, Mala D and Mala N 21-day pills. Okay. Now the next kind of contraception that we have is the implants. The implants are the next sort of contraceptive methods that are available. So here, what does this implants contain? See, same as pills, they also contain the progesterone hormones and estrogens. Estrogens. The only difference here is instead of taking them orally, these hormones, they are implanted under the skin, particularly under the arm most of the times. The arm, under the skin, under the in the arm region, in the arm region most of the time, they are simply are placed, and so they will be releasing these hormones every once in a while, every now and then these hormones are released. The only difference here is there you are taking the pills orally, and in here they simply are implanted under the skin. So you can see that here, since the composition is same as the pills, right? Since the composition is same as the pills, their mode of action will also be similar, correct? Effective periods are much longer because they are, you are taking them for 21 days, but they can be placed under the skin without harming the person for as many days. So that is why their effective periods are much longer. So that is the pills and as well as the implants. And emergency contraceptives, sometimes a pregnancy might come because of the unforeseen situations and as well as unplanned sexual intercourses. In such a situation, we have these emergency contraceptives available. What are these emergency contraceptives? Is administration of progestogens and progesterone estrogen combinations is as an emergency contraceptive, right? So you can administer both progesterone and estrogen combinations, and as well as IUDs. So immediately after the coitus, within 72 hours, IUDs can be implanted. IUDs can be implanted, and IUDs, as we have seen, and they work their way of preventing the pregnancy. Within 72 hours, IUDs can be there, and you can administer the progestogens and as well as estrogen and progesterone combinations. In which situation can you use this emergency contraceptives is to avoid the pregnancy due to a rape situation, that is unforeseen and as well as unprotected unplanned sexual intercourses. Unprotected and unplanned sexual intercourses use can also use the in situation the emergency contraceptives. And so all these methods that so far discussed are reversible, right? All these methods, hormonal changes, implants which have the hormones, again copper releasing IUDs, all these are reversible. But one thing that we have that is irreversible, or rather very poor rate of reversibility, is the surgical methods, which is also called as sterilization. Sterilization. So it is for the males and the females as well. It is for the males and the females as well. So what surgical methods that we have is, we have this tubectomy and vasectomy. That we have the tubectomy and vasectomy. So what is happening in the vasectomy is, this tube, this axillary male duct called vas deferens is cut and tied. Right, vas deferens is cut. In the case of tubectomy, what is happening is, these fallopian tubes, you can see in this diagram, these fallopian tubes are cut. Fallopian tubes are cut and tied. So in both the cases, you see only the gametes transport is stopped. Right? The gamete transport is stopped. No sexual organ is affected. We are not damaging any sexual organ. We are not damaging ovaries here, nor are we damaging the testis here. That means these ovaries and the testis will function normally. They release their own hormones. That means the sexuality of the sexes is not affected, and they'll be functioning healthy. Only thing is the transport of gametes is stopped. That is why it leads to the sterility, right? If you do not have any gametes, it leads to sterility. Okay, so that is the surgical methods that we have in the form of vasectomy and tubectomy. The key point to remember here is only the transport is affected. The organs, the reproductive organs, the ovaries and the testis is not affected, and the person is very healthy, and he'll have healthy sexual expression as well. So there will not be any problem there. And what we are seeing in this diagram here is you are seeing the implants, that we are seeing the implants in this diagram. So this can be mastic like small tubes will be there, a small match stick like tubes which are implanted under the skin. Okay, so what is happening here, they block the transport and prevent the contraception. So vasectomy and tubectomy, just now I have explained, right? So this point explains that the procedure of vasectomy and tubectomy. So here they're highly effective, but reversibility is very poor. That means you cannot again make them uh, make them untie them and again make the tube again. So it does not happen. It does not happen, right? So that is why the reversibility is very poor, very poor. And what is the choice for the couples? We have discussed all these contraceptive methods, and which method is best, which method is best is that is based on the need of each individual need of the couple, right? Based under the guidance and the guidance of expert doctors and qualified medical professionals, you can go for the preferred contraceptive methods based on the need of the couple. Do you want to delay the pregnancy for the years, or do you want to delay the pregnancy for months or days? So based on that you can go for the the desired contraceptive methods. If you want to delay the pregnancy say for a month or so, you can go for the barrier methods. Or if you want to delay the pregnancy for longer years, then you can go for IUDs. So a medical professional will counsel you according to the desired need, or according to desire, according to need of, according to the need of the couples involved. Okay, so here, so one thing you need to be remembering here is, so these are something which are interfering with something very natural as the pregnancy, as natural reproductive event as the pregnancy, but we are using them based on our situation that we are in. Sometimes we are forced to use to prevent the pregnancy or the delay the pregnancy, or due to some personal reasons, right? So since you are interfering with something very natural, obviously there will be side effects. Yes, obviously there are going to be some side effects. What are some of these side effects, if you can recall, is uh, these side effects is nausea feeling, nauseating feeling, right? Vomiting sensation is called as this nausea feeling will be there. Abdominal pain, particularly the IUDs sometimes can lead to have the pain in the abdomen. Breakthrough bleeding. So what is this breakthrough bleeding is? So when the IUDs are placed safely in the uterus, sometimes they break out. Sometimes they break out and they rupture the tissue surrounding it, right? The uterine tissue might be ruptured, tissue damage might be there. As a result of that, the bleeding can happen. And irregular menstrual cycles, and while we have these menstrual cycles irregularly and irregular menstrual bleeding, is because you are altering the normal course of function of the hormones, right? We're altering the normal course of function of the hormones. As a result of that, the menstrual cycles will become irregular, and sometimes even as severe as breast cancers might also be developing, right? So these changes are identified to be very not very significant, insignificant, but we cannot ignore the side effects as well. There are side effects because you are using something which is against natural, so against the natural method of the pregnancy. Okay, so those are the various methods of the contraceptive methods that we have, various methods of contraception, in the form of, just to recall what we have discussed, just to recap what we have discussed it so far. We began the lesson with the condoms. Yes, we have begun the lesson with the condoms. You can see the various condoms that we have: Nirod, female condoms, and additional benefit that we have here, and diaphragm, cervical caps, and walls, which are reusable. And we have seen some pictures of the condoms, right? Male condom, female condom, and IUDs. And chemical methods, so how they are spermicides also we have seen. And then we have gone to the discussion of intrauterine devices. Three kinds of intrauterine devices we have understood, right? In the form of non-medicated IUDs, copper releasing IUDs, and as well hormonal IUDs. As I have explained to you the importance of the names of each of these IUDs, and their function also we have understood. And then the pills, right? The pills in the form of 21-day pills and as well as Saheli. And how to use these 21-day pills also we have explained, right? Leaving a gap of 7 days. And Saheli, which is a non-steroidal once a week pill, also we have understood. And implants almost are as same as the pills only, because they have the same composition as the pills in the form of estrogen and progesterone, and their effectivity is much longer. And I understood the emergency contraceptives and which situation these emergency contraceptives can be used. Yes, and surgical methods in the form of tubectomy and vasectomy is also understood, and how do they work. And some side effects also have been briefly understood. In the next segment, what do we see is we'll see the medical termination of the pregnancy, and as well as some of the sexually transmitted infections will be explained in our next discussion, which is very important area for the discussion. Okay, so medical termination of the pregnancy, and as well the sexually transmitted infections, or I'll just take them in two segments because both are very important. So thank you. Thank you all.